Dear viewers, I hope you are all fine. This ultrasound video shows a stone in the ureter and diverticulum of the urinary bladder. You can see the right kidney and it shows minimum to mild hydronephrosis with minimum hydroureter. As you will see in the later part of this video that the size of the stone is very small and the stone lies in the distal portion of the ureter. The stone in the ureter nearer the kidney shows mild to moderate hydroureter, but if the stone lies in the distal portion of the ureter, if the stone lies in the distal portion of the ureter, the intensity of the hydroureter is small. You can see the ureter shows very minimum hydroureter. And it is very difficult to trace the ureter, but with repeated practices you can get a master of localization of this ureteric stones. This is the ureter and you will see there is minimum hydroureter. As the size of the stone is small and the stone lies in the distal portion of the ureter near the urinary bladder. You can see the ureter. Again, it is very difficult to localize. Now this crosses the iliac vessels and this is the middle portion of the ureter, right ureter. Now this is the urinary bladder and you will see a tiny stone, a small stone of about 6 millimeter in the distal portion of the ureter near the ureterovesical junction. The ureteric stones are the kidney stones that have become stuck in one or both ureters, the tubes that carry urine from kidney to the bladder. If the stone is large enough, it can block the flow of urine from the kidney to the bladder. This blockage can cause severe pain. You can see this is a small stone in the distal portion of the ureter, and you will see the measurement of the stone. The stone measures about 6.3 millimeter. So this stone is small though, so it causes a minimum hydroureter with minimum hydronephrosis. Now you will see this is the prostate, and now you are going to see the diverticulum of the urinary bladder. Now the bladder diverticulum is a pouch in the bladder wall that a person may either be born with, that is congenital, or get later acquired. A congenital bladder diverticulum forms when some of the bladder lining pokes through a weak part in the bladder wall. With acquired diverticulum, many pouches often forms. Now you can see the diverticulum, and in the left lateral wall of the urinary bladder, this is a diverticulum and it measures about 42.6 millimeter into 24.1 millimeter. Now you can see the communication between the urinary bladder and the diverticulum, and there is a small amount of thick sludge seen in the urine present in the diverticulum. This is the communication between the urinary bladder and the diverticulum. This is the communication between the urinary bladder, and the diverticulum. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.